Welcome to the TNT Unpacked Mental Health Series. We are your hosts, Justin Collymore and Rochelle Amore.
Hey.
As some of you know, every month we will be discussing a different topic that relates to mental health and speaking to different subject matter experts. However, we felt it would be fitting to do an introductory episode to kind of explain the mental health industry, the mental health
perspective.
Yeah.
Coming from a psychiatrist, a very well-trained and well-qualified psychiatrist, one of our favorite people, Dr. James Bratt. I almost said your
Hello.
middle name.
Please don't.
So welcome and thank you for joining us.
Thank you for having me.
Thank you. So Dr. Bratt is a psychiatrist. We're just going to refer to him as James. And he's going to just answer a few common questions about people going to the psychiatrist. We know that there's a stigma. People are really afraid of admitting that they need help when it comes to mental wellness. And we're going to unpack it a little bit and really break it down to help us understand that it's really not that scary. It's really not that big of a deal. The same way that you need help to go to the doctor, you get a flu or you get an infection, it's the same way every now and then you're going to need to visit a mental health professional. So let's dive in.
All right, so James, can you give us like a little background, like an elevator pitch of who you are?
So after I finished A-levels here in Trinidad, I went to medical school in Ireland at the Royal College of Surgeons in Dublin, and that was for 6 years. Finished medical school and did 2 internships, one in pediatrics and one in medicine and surgery, internal medicine and surgery. And then by then I had decided to train as a psychiatrist. So went to London and trained as a general psychiatrist, which takes 3 years. And then I did my subspecialty training in what in the UK is called old age psychiatry. In North America is called geriatric psychiatry. And that took me another 4 years.
Wow.
So there I am.
Yeah, 17 years later.
I kind of skipped on some parts so I wouldn't bore you to death.
Very nice.
So I see you mentioned that you did an internship in pediatrics, and that reminds me that your father is actually a very well-known pediatrician, Dr. David Bratt.
That's right.
Who does an article in the newspapers every week. So that's interesting. What is that like? Not really following in his footsteps, kind of the other end of the spectrum, right? He does kids and you do old people.
Yeah, so the joke is the old Brat does the kids and young Brat does the old people. That's how I remember it. Actually, funny enough, there's a lot of similarities between geriatrics and pediatrics. At the beginning of your life, your brain is developing, your body's developing, and at the end of your life, unfortunately, a lot of times, your body and brain are deteriorating. So there are lots of parallels. So often I can actually speak to my father about cases because he'll understand, I think, a bit better than a general medical doctor would. For example, a lot of times when we're taking the history in geriatrics or geriatric psychiatry, same thing, we can't get the history from the patient. We have to ask the relatives, for example. And that's the same with a baby. You can't ask the baby questions. You have to get the history from the parents. So lots of parallels.
Do you feel like there's a parallel between your life and George Bush because his dad was the president?
Oh, I never thought about that. That's a good question. Well, when I came back to Trinidad 2 years ago, a little Chinese guy, journalist from one of the newspapers, asked me to interview me. So I said, okay. And one of the questions that he asked, which was funny but unexpected, was, Dr. Bratt Jr., do you think you are living in Dr. Bratt Sr.'s shadow?
Yeah.
And I said, well, I'm hoping to make my own shadow, but I'm sure I have benefited from having a well-known doctor father. I'm sure I have.
Sure.
So
Yeah, he also likes to boast that he's actually Dr. Bratt 2.0, new and improved.
new and improved model.
But okay, so even though your specialty is in geriatric or old age psychiatry, we know that you've done a lot of training in the field in general and you're very familiar with psychiatry overall. Having returned to Trinidad, you've had to work within the local psychiatric industry, if that's a thing, right? So tell us a little bit about what we might expect when we decide as lay people to go see a psychiatrist.
Okay, so One thing to say first is that I work in the private sector, so in Trinidad. So I have never worked in the public sector here. So I can't really comment too much on the public sector. But I think if you're a layperson and you decide to go to see a private psychiatrist, the one thing, well, at least if you're coming to see me, there's nothing really to be scared about. Very often my patients will tell me that they didn't sleep the night before. They were so worried about coming. Psychiatry has a stigma. People have this idea of psychiatrists from Hollywood movies, this old guy who makes you lie down on the couch and ask you all these questions about your childhood, and that's not what it's like actually. That's actually psychotherapy, which is a totally different thing, and that's a very specific type of psychological therapy. It's not that common these days.
It's kind of phased out.
Yeah, and I mean, I am a younger psychiatrist, so I think the approach of all younger doctors is probably a little different. We try to be more relaxed, try to be more approachable. So you're simply coming to me in the first instance, I'm going to ask you lots of questions about your history, what we call in medicine a medical history, and I'm just trying to get an idea of what's going on at the moment and kind of background info. And then go from there, really. So it's nothing to worry about. It's just questions, like any doctor's office. But we spend a lot more time than other doctors. So in a new patient assessment, I would spend between an hour and an hour and a half asking you questions.
So we're talking a lot about psychiatry, which is your specialty. But people listening might be confused about the difference between psychology and psychiatry. A lot of people don't even know that there is a difference between psychology and psychiatry. And I know what usually happens is you might go to a psychologist first and then you might get referred to a psychiatrist. So do you want to explain the difference there and how that relationship works?
Okay, so psychiatry is a subspecialty of medicine. So all psychiatrists are doctors, medical doctors. So we've all gone to medical school. We can prescribe medication. We order tests if tests are necessary. I think it's confusing even for people in the field because there's a kind of a big distinction between the British way of doing things in medicine and the American way of doing things. And so my understanding is that quite some time ago, psychiatry and psychology split off from each other in the UK. So they're quite separate. Whereas in the States, I understand that a lot of psychiatrists do a lot of psychology. So psychologists are people that treat people with emotional problems, emotional disturbance for whatever reason, and they use what's called talking therapy for the layman. So they don't prescribe and they don't order any tests in the same way that we do. And they're actually quite separate fields. One is not under the other. They're very different. I mean, obviously they're very related, but they're totally two different skills. Now, some psychiatrists do subspecialize in psychotherapy, which is where it becomes a bit confusing. So you can go to a psychiatrist for psychological treatment if they have specialized in that and done specific training. I myself have not had that training, so I don't see people for talking therapy. I will refer them to someone else.
So people just come to you for drugs.
Yeah, that's basically that basically sums up my career. Yeah, we give out the good stuff.
Yeah. So if somebody came to you and they were like, "Yeah, I just broke up with my girlfriend," what would you tell them?
Well, seeing that I'm a geriatric psychiatrist, I don't get that problem too often. It does happen, but yeah, if somebody is extremely distraught because of a situation in their life, my personal opinion is that drugs are not warranted in that circumstance. That's, it's a reaction to something bad that has happened in a person's life. And I don't think that drugs are the answer. I think working through the emotional problem is the answer, and that's a psychologist. Or a psychiatrist who's trained. That's the key word there, underlined, trained in psychotherapy.
So give us an example of a time that drugs will be necessary.
So again, another layman term is a chemical imbalance. A lot of people talk about. So there are some people, and the theory is that the happy hormones, for example, serotonin is one of them. There's a theory that some people just have low levels of serotonin in their brain, and therefore they can be kind of depressed all the time for no particular reason.
Right.
And so that's where antidepressants come in, because they raise levels of serotonin in your brain. I have seen it work wonders. So I know a lot of people don't seem to believe in antidepressants, but when you've seen someone who's stopped eating and drinking and talking, and you give them medication and they get better, then you'll believe it. There are circumstances where definitely antidepressants, for example, are indicated, but definitely they are also overprescribed. So, for example, the UK guidelines are that people with mild depression, which is defined as depression that does not interfere with your day-to-day functioning, those people should not get antidepressants. But if you are considered to have moderate or severe illness, that's when you should get medication.
So if somebody comes in and they don't have any illness or any sort of issues, and you give them a certain medication, what sort of effects might that have?
So all medications have side effects. So a lot of people are rightfully concerned about side effects. So it's something that I talk about very directly and openly, because we know from a lot of the studies in public health that up to 50% of people don't actually take medication as prescribed, whether they don't believe it or they're getting side effects or they forget or whatever reason. So it's better to address it early on, you know.
Yeah, my grandmother is one of those people. She will Google a medication and she will look at the side effects and she would say, nope, not taking it.
Yeah. So I actually have handouts in my office, and I pick and choose my handouts carefully, because you want to give people the truth, the proper information, but you don't want to freak them out. And I always tell people, if you're so concerned about side effects, you read the side effect leaflet for paracetamol, which is Panadol or Tylenol, and you won't take that either. So
I just took 2 of those.
So, you know, those leaflets have been written so that drug companies don't get sued, or if they get sued, they can cover their asses. But any medication can give you side effects, but that doesn't mean it's going to.
So, I mean, I imagine as a psychiatrist, there must be some anxiety or some concern sometimes when you're prescribing drugs to people. Like, you might worry, what if this person abuses this drug? Or do you take measures to sort of prevent that?
I'm very, very careful with medication, and because I work with older people are more susceptible to side effects. So I only prescribe low doses and I only increase it as needed. If I have concerns that a person will not take medication appropriately, I just won't prescribe it. And I'm very, very careful about addictive medications, which a lot of people in Trinidad and Tobago are on. And I liaise closely with the pharmacists if need be.
What are some of those medications you just mentioned that they're addictive and a lot of people locally seem to be dependent on them? Because I think that's something we take for granted. Oh yeah, I'm just going to take my medication, and years later this person is still on that medication.
No, literally 20 years later they're still on it. So there's a class of medications called benzodiazepines, and the ones you may have heard of are Valium, Ativan, Xanax, Rivotril, Dormicum, and Lexotan. So those medications are licensed to treat acute anxiety. That means anxiety that is very severe and that comes on suddenly, let's say a panic attack. And they work really well in the short term, and they're perfectly fine to use in the short term, but they are addictive, and then you'll need more and more and more of it to get the same effect. Like any addictive drug, your body develops tolerance, and then it becomes very, very hard to get off of them.
So is it like you get a high from taking these drugs?
Well, they calm you down, so they kind of like they lower anxiety levels and nervousness and stress, so they work quickly. So that's why people love them, because you pop a pill and half an hour later you're already feeling better. Whereas going to a psychologist, for example, every week for months on end is hard work and expensive, so nobody wants to do that.
So is it that people then become dependent on these drugs to function in everyday life?
Can do, yeah. And then to get off of it, it's like any drug, whether it's cocaine or a prescribed drug. If it's addictive, it's hard to come off.
So just in case anybody is wondering about what James is talking about, anxiety and nervousness and stress, we will, during the series, touch on each of these topics separately with a qualified psychiatrist to explore some more about what these terms mean and how they can affect our everyday mental wellness. But getting back real quick to these side effects, can you just, you explain that the side effect leaflets that can be very scary are really just to protect the drug companies. Can you just briefly, in layman's terms, explain, okay, these studies that have proven these side effects may not be common. They might occur 1 in every 10,000 people or something like that. Can you just give people an idea of what it means?
Yeah, so when you look at a side effect leaflet, if you look at the one that comes in the medication box, it'll say common side effects, and then more common, rare, and then there's moderate. So I tell people about the common side effects because common things are common. So if you're going to get an upset tummy or you might get some dizziness, then I want you to know about that. And common side effects usually don't last more than 1 or 2 weeks. So you might have to put up with it for a little while, but they usually go away when your body gets accustomed. Yes, any medication can give you a severe side effect, but that's rare. So you have to weigh up in your mind, is it that you're not going to take the medication because you're so scared of side effects? But then we hardly ever, or maybe we've never seen that side effect. Maybe one person in the whole world had it, but it's on the list. So,
just in case.
Yeah.
Can we talk about St. Anne's for a moment? Because I know, like, especially here, a lot of people, well, probably only here, people, like, it's a big joke, you need to go St. Anne's or...
Go in the madhouse.
Yeah, or the madhouse is what they call it.
Yeah. You're probably better off asking somebody who's worked in St. Anne's or in the public sector, because I haven't in Trinidad. But St. Anne's is what used to be called an asylum. So this comes from the UK, from England. That was how psychiatric patients were treated many years ago. The rest of the world has moved on.
Right.
We're still stuck in the same.
Still stuck in those times.
So the idea, modern way of treating psychiatric illness is that people are actually reintegrated back into society. So you try to discharge people out of hospital as soon as possible, whether that's home or you can have community wards. So there are wards that are based in the community and people can come and go. There's halfway houses. There's all sorts of different models that are used in different places. But the idea is that people should not be shut away in a big institution and the key thrown away, which is what St. Anne's is, because St. Anne's has something like 900 people living there. I think it's really supposed to be for about 400 or 500 people.
Wow.
So I've been on one of the wards when I had a tour when I came back, and it was horrific conditions. I mean, and that's not a criticism of the people working there. They're doing the best they can. It's a criticism of the government and of the Ministry of Health that does not place any sort of validity or importance on mental health issues. So there's a huge, as you said, there's a huge stigma and jokes. He going to the madhouse, or send him by St. Anne's, and actually it's sad because it just perpetuates the problem.
And on that note about not placing enough emphasis, I think culturally as a country and as a region, Latin America and the Caribbean, we don't have a great history of placing emphasis or valuing mental health issues. And I know in some research that I came across that I think less than 1% of our local Ministry of Health budget goes to mental health.
Yeah.
And then of that less than 1%, about 90% of it goes to St. Anne's. Because that's the only psychiatric hospital.
Yeah.
So you can imagine less than 1% of the budget, how very little that is to survive on and run that hospital. So that's, again, not a criticism of the people working there, because they have less than 1% of the budget to work with.
Yeah, they're doing what they can. If you look at the World Health Organization studies, that you can actually try to quantify something called morbidity and mortality. So those are fancy words, meaning morbidity is how sickness, the level of sickness of a population, and mortality is how, is death. So how many people die as a result of an illness. And if you look at morbidity, for example, psychiatric illness has an extremely high morbidity. So it means that people suffering from these types of illnesses are not able to function in their lives because they're so ill, and then that there's a knock-on effect with the families, whether that's an emotional effect or a financial effect. So actually, you're better off in the long run pumping money into mental health services, and the whole society is actually going to benefit from it. But we have a very short-sighted view that we talk about CHIKV and Zika virus. Yes, I'm not saying they're not important, but from a public health point of view, by the way, I have a background in public health, so that's why I'm talking about it a little bit. From a public health point of view, why do we want to spend millions on CHIKV and Zika virus when actually, a huge amount of people suffer from things like depression or dementia or diabetes? Those are things that we should be focusing on, chronic illnesses. So the United Nations about 2 years ago had a big convention, and they said that we need to focus more on chronic illnesses rather than these illnesses that are in the media and make a big splash in the media, and everybody gets all worried about them.
So I studied psychology, and when I came back to Trinidad, somebody told me there's no regulatory body. Right. You can pretty much just set up your practice and get going. How
That's Trinidad.
With a bachelor's degree, right?
Bachelor's and or master's.
Okay.
Yeah.
Right, so that's pretty much true. All doctors have to be registered with the Trinidad and Tobago Medical Board or
Right.
Medical Council, so I am. But for psychiatry, there's nobody that you have to register with. There's also no definition of what a specialist doctor is in Trinidad and Tobago. So I could call myself a cardiologist tomorrow if I feel like.
Yeah.
And obviously, I'm not a qualified cardiologist, but there's no definition, so therefore nobody can do anything to me because
They
I
can't sue you for malpractice or anything.
I mean,
like that.
I'm sure they can, but is anybody going to? I don't know. It's Trinidad. There's a lot of people who call themselves things in Trinidad and Tobago and they are not those things.
I mean, I call myself a spiritual healer
right.
from time to time.
Okay. What kind of spiritual healing are you talking about? But for psychologists, there's a Trinidad and Tobago Psychology Association. But again, none of these organizations have teeth. There's no legislation that is governing it. So
Right.
yes, you can join organizations and you can hope to maintain standards, but actually they can't really do anything.
There's no real power
No,
that they possess.
because we need a change to the mental health, the legislation that is governing healthcare professionals in the country.
And do you think that has a damaging effect on people who need mental help?
Well, I think if people who are not properly trained are seeing patients, then yes, that is
Right.
very bad. And also, it occurs to me that maybe the public loses faith in professionals because, you go to your doctor or whoever for treatment and it doesn't work, or you don't get an appropriate treatment, then of course you're not really going to trust them anymore. And then I'm not surprised that people go to spiritual healers
Right.
because maybe they have faith in those people better, more, I mean. So.
Yeah.
So on that note, if I go to a psychiatrist and I'm dissatisfied, or I find that the treatment that he's given me actually made things worse for me and affected me negatively, there's no one that I can go report this to and complain to about this person?
I'm sure you can always report it to the Ministry of Health, or the medical board, but really and truly, is anything gonna come of it?
Okay, just leave that there.
So, Rochelle, we can start up our practice tomorrow.
Yeah.
We'll be
Because we both have first degrees in psychology.
Yeah.
We, so now that we know that technically we're qualified, we can actually start to make some real money.
People seem to be like pretty guarded and secretive. Well, not secretive, but people don't seem to be very open about, if they need mental help. Where do you think that stigma comes from?
Various things. A lot of people just don't believe it. They don't believe it's a real thing. I think human beings, we have a problem sometimes believing in things that we can't see or things that are intangible.
Right.
So, you go to a surgeon and he cuts out whatever part of your body and then you see the scar. So, it happened. But, you come to me and I give you medication and I tell you, well, actually, it will take 4 to 6 weeks to work. And then I'll see you again and see if it's helped. And if not, we'll change the dose. I mean, it's harder for people to grasp that or to understand, that it's just a different way of helping you. And also it's a small place, so people are quite secretive about their business because, people
they don't want to be judged.
Yeah, and small places are judgmental. And so probably that's part of it as well. I think having come back from the UK, I feel that people in the UK compared to Trinidad are a lot more educated and aware of mental health problems, whereas people in Trinidad are still sort of kind of thinking, well, that is only mad people. It's not me. It's never me.
Yeah.
Whereas, they say that, 25% of people over their lifetime will experience some sort of mental health problem. It doesn't mean that 25% of people right now have mental health problems, although you might think so driving around Trinidad. But it affects everybody. If you think you're immune, then guess again, because nobody is.
Because the impression I get is that people go see a psychologist, therapist, or psychiatrist when there's some severe problem,
Right.
or they're trying to deal with something that they can't cope with.
Right.
But I mean, do you think that there's some value in people kind of just going in for like a checkup type deal?
It's a good question. This kind of brings me back to the whole topic of the difference between British medicine and American medicine. So in the British view of things, we should encourage wellness and sort of not focus so much on, checkup and scaring people. If you're well, don't go to the doctor.
Okay.
Whereas the Americans have this sort of view, everybody should get a full medical. Like, every year, on a full range of tests and, sort of investigate too much, in my opinion. To answer your question, no, I don't think you should come to me, a psychiatrist, just to check up that you're okay. I think you're far better off using your time and your money doing healthy things like exercising, watching your diet, not drinking too much, all of those things that we know we're not supposed to do, or are supposed to exercise and not drink so much. We need to promote healthy living, and that's, again, a public health thing,
Right.
Prevention is better than cure, but you don't need a doctor necessarily to do those things.
You were talking about the difference between the UK, the awareness of mental health issues in the UK versus TNT, but I know that from your experience in other islands, it's also the case throughout the Caribbean and just generally in smaller places. We seem to not have much of an awareness in general of mental health, and that stigma of it could never be me. Although, like you said, 1 in 4 people are estimated to experience a mental health issue in their lifetime, but still, if we have an aunt that was kind of weird or an uncle who went to St. Anne's a few times in and out, we try to hide it.
The shame.
Yeah, it's very shameful for some reason in smaller countries like Caribbean region. What do you think needs to happen to try and promote better awareness? Is it on the government? Is it on practitioners? Is it on people who experience it themselves?
Well, I think all three. So from a governmental level, the Ministry of Health and also CARFA, which is the Public Health Agency, both have a responsibility in raising awareness. So in other countries, there are ads on TV that will promote awareness of mental health issues. And then the doctors, as far as I understand, medical students, when they're at UE, they're not getting very much training when it comes to mental health problems. We all in medical school have to rotate through all the different specialties, but I don't think it's focused on, whereas I actually used to examine in London for the medical students, and I was always very impressed about how much they knew at a medical student level. I don't think the other problem is doctors in TNT are not required to keep up with their medical knowledge. There is no mandatory ongoing training called CME, which is continuing medical education. It's really up to the doctor. And most people with mental health problems are actually seen by GPs, not psychiatrists. So actually, they're the key doctors in any society, the general practitioners. And we need the GPs all to have mandatory training in the treatment of mental health problems, which there is none. So there are some GPs who are very interested and very good and manage things very well. And there are some that are not so interested.
So there are some GPs who, if you go to them, they will pick up quickly.
Yeah.
These are signs of depression, or these are signs of bipolar disorder, and they'll be able to refer them appropriately.
Yeah.
And then there's
Or
some
manage them if they're able to.
Okay,
which is
so they
great,
can manage them themselves.
Yes.
Okay.
The way it works in the UK is that GPs, by and large, will manage mild problems and depending on their level of confidence, moderate.
Okay.
But some GPs will refer for moderate, and then everybody with severe mental health problems should be under a psychiatrist.
Okay, understood.
Or psychologist.
Okay, so if it is that you're having a problem, you don't have to go see a specialist, a psychiatrist. You can take it to your GP.
Yeah,
if
absolutely.
You're confident.
I mean, GPs are usually the first port of call for any medical problem, and then if the GP feels it appropriate, he can refer it on. So yeah, no, I'm very happy with that. Or you can come directly to me. I mean, either or.
A psychiatrist / psychologist, actually the craziest of people.
I prefer to think that we are more interesting and open-minded people. Although saying that, there are some people who go into the field because they are trying to deal with their own problems. But I think we are the least judgmental. For example, psychiatrists. I mean, you really have to not be a judgmental person to do this field because you're seeing sort of people with all sorts of very difficult problems, and it's certainly not the most glamorous of all the specialties. We are the Cinderella specialties. So,
Right.
yeah.
So do you ever see people and kind of think to yourself, oh, this person is just being dramatic?
Well, it's an interesting point. So there is a diagnosis called personality disorder, not very well known in TNT, and some people just have traits of those disorders, and some people have the full-blown disorder.
Yeah.
So there is something called histrionic personality disorder.
I've heard of it, yeah.
Yeah, and some people just have traits. So whereas some people, to have a diagnosis of personality disorder, it has to significantly impact on your life.
A lot of people, Rochelle and I were talking about this earlier. We were talking about drugs, prescription drugs earlier, but a lot of people self-medicate with certain illicit drugs in Trinidad.
Right.
Do you think we have an underlying issue in terms of
Self-medication via drugs and alcohol.
Absolutely, and I think that's everywhere in the world. The problem is exacerbated in TNT because you can get medications off prescription. Everybody knows which pharmacies to go to and which pharmacist will give you a favor and things like that. So so that's very unhelpful. And also a lot of doctors do just prescribe. They just prescribe willy-nilly. And that's also bad. But yes, a lot of people do self-medicate with things like alcohol or let's say marijuana is a good example. And often it's because they're having mental health problems or they're having really difficult situations in their life. Maybe they've gone to the doctor and not gotten help. And so you go and smoke a spliff or take a drink and you feel better because it's an instant solution. You feel better in the short term, but not necessarily in the long term.
James, I find that illegal jargon came very easy to you. I just want to say...
It seemed very familiar.
Very natural.
Well, I used to work in a place called Camden Town in London, which is the drug capital for the United Kingdom.
Yeah.
So my typical night on call in the emergency room would be drug addict and alcoholic, one after the other. So that was a typical Friday night for me.
Sounds like fun. What do you think, last question, I think we're just wrapping up. I know you said you have not worked in the public sector, so you can't speak much about that. But for people who might not be able to afford a private psychiatrist or even a private GP and are having issues in their personal lives or having emotional problems, is there anywhere that you might recommend they might go?
Okay, so there are public psychiatric clinics around the country. It depends on where you live. So it's sort of a zoning thing. So for example, Port of Spain, the main psychiatric clinic is at Pembroke Street Wellness Center. Also, there are clinics at St. Anne's Hospital, obviously. For the West, it's Pity Valley Health Center, which I know specifically is on a Wednesday morning. And there's all over. There's Barataria Wellness Center on the Eastern Main Road. That's a big one. There's San Fernando. There's Siparia. There's all over. Arima. There's quite a few. The information is actually available from the Ministry of Health. And so they tend to be underfunded, overcrowded, and long waiting time. But that's how it goes in the public sector.
Yeah.
But it is available,
Okay.
it is available, and that's free,
I
of
think I
course.
did get in touch once with the Pembroke Street center, and they did seem very professional, and they handled my question very confidentially and very, very considerate, because it's a sensitive issue, like we were
Right.
talking about earlier. A lot of people feel ashamed.
Yeah.
So I think, they are aware, and like we've kept saying, these people who work in these places are doing the best that they can with their limited public funding. So yeah, I guess prepare for a long wait time and prepare for, the overcrowding, but still it's an option.
Yeah, I mean, it's there, so, you should use it if you can.
All right.
I think that's it.
I think that's it.
Thank you very
Okay.
much.
Thank you
James.
so much.
Thank you.
Hey guys, if you're interested in being featured or would like to advertise with us, you can reach us at unpackedmedia@gmail.com, and you can also find us on social media.